Let's be honest, no one looks forward to going to the dentist, but regular checkups are necessary for good oral hygiene. Brushing and flossing alone are simply not enough. I'm Herb Weisbaum, the Consumer Man, a contributing editor at checkbook.org.
Welcome to Consumerpedia at checkbook.org. We're the nonprofit that helps consumers select services, avoid trouble, and save money. Because we don't accept any advertising or take money from any business we recommend, you can rely on checkbook.org to be completely independent and objective. Now, here's the host of Consumerpedia, America's consumer expert, the Consumer Man, Herb Weisbaum.
Oral health is important to your overall health. According to the Mayo Clinic, problems in your mouth can affect the rest of your body. Bacteria in your mouth and the inflammation associated with severe gum disease might play a role in some other diseases, such as heart disease, pneumonia, and complications with pregnancy. In this episode of Consumerpedia, how to find a good dentist, what to do if your dentist recommends some extensive and expensive work, and ways to save money while still getting quality dental care. Plus, we'll look at the pros and cons of dental insurance and how you can decide if it makes sense for you. Here to help with all that, Checkbook's executive editor, Kevin Brasler. Hey, Kevin.
Hey, Herb.
Going to start with a personal question. Is that okay?
Maybe.
Are you a manual or a mechanical toothbrush sort of guy?
Oh, I'm a manual toothbrush guy. My kids used the mechanical ones for a while, and then they just broke them, and I got tired of paying for them.
Well, I'm a mechanical sort of guy. I've been using one of the ultrasonic toothbrushes for almost 30 years. And the great thing about it was it changed my entire relationship with my dentist. Instead of every time him saying, you missed a spot over here and you got to get that molar back there, he goes, you did a great job. Congratulations. So it changed my whole relationship with the dentist. By the way, I love my dentist. I've had the same dentist since I moved to Seattle back in 1981 and the same hygienist. And I got to tell you, he's top rated by Checkbook. I just checked the ratings. And when he gets ready to retire in a couple of years, I'm going to be lost because if you find a good dentist, they're just great.
It makes all the difference, right? I had a dentist that I wasn't crazy about for several years. It's one my wife has used since she was a kid. And I finally switched upon the recommendation of Jamie Lettuce, who's a colleague of ours at Checkbook. She found a great dentist downtown near the office. And started going to her, and it just makes all the difference. I'm not looking forward to going to the dentist to get cleanings and checkups every 6 months, but it doesn't make it so miserable, right? Mm-hmm. When you have a great dentist, when the person doing the cleaning is gentle, when they discuss things with you and communicate with you, and really give you feedback in terms of things. It just makes all the difference in the world when it's a more pleasant experience.
Funny story, because I'm in the news, my dentist always wants to talk to me about things when he's got his hands in the gauze in my mouth. And I always got to go time out, do the timeout sign and say So I finally said to him, if you want to talk to me about the news, let's go to lunch. So he took me to lunch once, then I had to brush and floss afterwards. But anyway, it's... All right, let's get serious. Checkbook does ratings. So, it might be easy to assume that all dentists are good. They had to go to dental school and they probably have diplomas on the wall and maybe members of organizations. But as always, you found out that there's a lot of good ones, but not always everybody's equally as good.
Yeah, I think that summarizes it. Overall, the practices that were evaluated by the patients we surveyed, their patients, rated fairly well. I mean, the average overall rating for overall care is, up in around 90%, which is really high compared to a lot of the service categories we evaluate. The problem is there still are a lot of stinkers out there. There are a lot of dentists who their patients just are not at all satisfied with the care they're getting, with communication, with waiting. We ask them questions like, do they limit the time in the chair? And a lot of dentists get low ratings for that. A lot of dentists get low ratings for not listening and communicating with their patients. And so, as you and I know, right, we've had dentists in the past that we weren't crazy about. There are dentists out there that just aren't doing very well by their patients.
And what about the certificates and the organizations, the memberships they have in various things? Is there a lot of oversight? Should we put a lot of weight in those kind of things?
Yeah, no, unfortunately, and this is true in the medical world overall, there's no one, supervising most dentists' work. And so there's really no one checking to see whether or not they're doing good work versus lousy work. There are dental boards that will handle complaints about their member dentists, but that's getting to a level of a serious problem has occurred, a serious accusation has been leveled against a dentist. Then they're kind of being investigated, but there's no one every day to day, making sure that overall that dentists are doing very good work, and that's really somewhat true also of, say, surgeons. It's not as if every surgery is evaluated by their peers after it occurs. The problem with dentists is that it's usually most dentists operate on their own as a single practitioner or with a very small group of dentists. Often they're family members when there's more than one in the office. And so there really isn't a lot of peer review of what's going on.
So while a license doesn't guarantee you're going to get good quality work, if you're doing some kind of specialty work, should you be checking some kind of certification for that?
Yeah, so if you need specialty care, if you need a root canal, if you need to see a prosthodontist, then you definitely want to look to make sure that those dentists that you're considering are board certified. There are certification groups for specialties among dentists that are similar to what you see for physicians. And so while most dental specialists are certified, the vast majority are, it's still a check worth doing before you visit one.
Price may be a consideration for some people when getting medical care. It may not be for others, depending on your insurance coverage, that sort of thing. But from a price point of view, how much difference did you find from dentist to dentist for the exact same procedure?
We found astonishingly big differences from practice to practice. We found that some charge, 4, even 5 times more than nearby kind of competitors for the same procedure. If you need expensive work, like if you need a new crown, we're talking about $1,000 plus difference between the highest priced practices and the lowest priced ones. And even for things like, just preventive work like cleanings and, every 6-month checkups, I found huge price differences for that also. So, for fillings, we found that some practices charge hundreds and hundreds of dollars more than others for this same exact work. So you do need to pay attention to costs. We found that dentists, the practices we looked at, our undercover shoppers checked prices with hundreds of different practices and found massive differences in costs that they charge from practice to practice. And I think, though, most patients would say, yeah, but, I don't want to go with a lousy dentist, the cheap dentist that may not offer the best care. And fortunately, what we found is you don't have to. The best practices have huge ranges of prices from practice to practice. You don't have to pay more to get better dental care at all. We found that many of the practices that get really high ratings from their patients charge low prices. There's really is no relationship between quality and price when it comes to dental care. You can go with a lower priced dentist and still get good care. You really do have to look at those two topics kind of separately and not combine the two and assume that low prices means lousy care.
And I'm looking at the ratings that we just published for dentists in the Seattle area, the Puget Sound area. Bite Wing X-rays, 4 films. The low price was $40. The average price was $85, and the high price was $191. I mean, Bite Wing X-rays are Bite Wing X-rays,
You wouldn't think that there would be such drastic differences. We've been covering this dentist for 40 years now, and again find these huge differences from practice to practice for the exact same care, the exact same filling on the same tooth, the same crown, the same bite wing x-rays. Again and again find these huge differences. And most patients are completely unaware, really, that one way to save is just by choosing a practice that doesn't charge really high prices, but still offers great care.
Maybe the high-priced x-rays, you're going to get a couple of 5x7s and wallet-sized photos or something along with the deal. So,
I don't know.
Let's talk a little bit more about price. You have a caution to people about incentives that dentists may have to drive up the price by doing work that's not necessarily needed, or maybe more work that's needed, or whatever. Could you just deal with that a little bit and help us understand what's going on?
Yeah, we get a lot of complaints from patients who say that their dentists, often dentists that they're trying out for the first time, that they're being told that they need lots of expensive treatments. A common thing is that they're told they need to replace all their fillings, their old fillings. And it's alarming. There are a lot of conflicts of interest, especially financial conflicts of interest, not just in dentistry, but in the entire medical field, but especially with dentists who are practicing on their own to kind of do too much work in order to make more money. A problem for dentists these days is that because patients, consumers have gotten so much better about care, about brushing several times a day, about drinking fluoridated water or using mouthwashes and making sure that they're getting fluoride, about care when they're young. We've doing a lot better job these days of making sure our kids get dental care. So the problem for dentists, though, is that people need less work done. We have fewer cavities, there's fewer needs for crowns and root canals and things like that. But more dentists are graduating from dental colleges. And so there are fewer patients to go around, less work to do. And so a lot of dentists branch out into cosmetic work. They're offering whitening services, things like that. Some dentists are kind of getting involved in specialty care. They wouldn't have ever considered doing a root canal before, but some are doing them in their own offices. General dentists are now. And then some, unfortunately, clearly are just overselling. They're telling their patients they need work that the patients don't really need. They're suggesting they get x-rays more often than they need them. And then as we hear from patients, some are telling them that, well, we need to replace all your old fillings. Unnecessary work is being done by these practices because of the financial need on behalf of the dentists.
So it sounds like if they propose something dramatic, that it might be worth getting a second opinion, just like you might with any other doctor.
It's a big red flag, I'd say, that especially if you're seeing a dentist and you have a new relationship with that dentist, if you're being told you need really expensive work, even if you trust the person, I think it's worth getting a second opinion. I mean, it really is the most underutilized consumer tool out there, not just for dentistry, but in the medical world in general. It's really a good idea to get a second opinion. The dentist should be willing to give you a written treatment plan with costs, and you should be able to take that to another dentist and have them check and say, is this really what I need? Is there a less expensive way to do this? And also, it's another way to check on costs to make sure you're not paying too much, right? You can take that treatment plan to other dentists and find out what they would charge you for the same care, the same procedures. But I think really more important than that is to make sure that you actually need that care, that you need that expensive work done.
And most dental plans will gladly pay for a second opinion because they know that it might save them money in the long run.
They will. And if you're just comparing cost, another dental practice should be more than willing to take in this written treatment plan that you've been provided and quote a price for you based on their fee schedules.
One of the things I like about my dentist is if there's a problem, he sits down and talks to me about the options. Well, we could do this little repair and it'll cost this amount of money and it'll last 2 years, or we could do this thing and it probably last you 10 years and it would do this, or you wanted to fix it forever and we can do this and this is what it's going to cost and the upsides and the downsides. And he's never really pushing stuff on me. We're having a discussion. That's the kind of medicine I like. You're a partner with the doctor and you figure out what's the best plan for you. That's how I think this should happen in the real world.
I completely agree. And that's why I love my dentist. Yeah, I don't have dental insurance. It's just she knows anything that she does, I'm paying for. Yeah, I have a 100% deductible, right, when I visit her. And so does my wife. And my wife over the years has needed really expensive treatment. So she knows that, some things that we can put it off a little bit or some things I'm more cost conscious on, she'll work with me in terms of doing it. But, it's good at least to get that feedback from her as opposed to being told, oh, no, you need to do this. You have to do this. That's not always the case. I mean, obviously, if you need a cavity filled, it needs to get filled. But there's other things in terms of other work you might need that you might be able to put off, that you might be able to kind of lengthen the time in between x-rays are done, for example. And there's different types of crowns they can put in. Some are less expensive than others.
So I'm a little bit older than you. We'll keep that a secret, but I'm on Medicare Advantage. So while there's not dental insurance or coverage per se, you can get reimbursed for a certain amount during the course of a year. You have to fill out the paperwork and it can be a lot more complicated than it sounds when you're signing up for it, but you will hopefully eventually get the money if you're with a good company. But so my doctor knows, and he said to me, using this new toothbrush, this electric toothbrush, you're not building up the plaque like you used to. You don't need to come in every 6 months. My teeth are rock solid, never had a cavity in my life. And he said, come in every 9 months for a cleaning. Your wife, who's got some gum problems, Deb comes in every 3 months to take care of that. If you pay with a check, I'll give you a discount for paying with a check, and I'll give you a senior citizen discount, and I'll try to save you as much money as possible. I thought that was wonderful.
Yeah, and that's really the way it should be. The every 6 month schedule that most of us are on, some of us should go more often and some should go less often. It really does depend on your history, and dentists should be flexible with that also. It shouldn't be, everything's rigid and set in stone and they have a certain way of doing things. Unfortunately, a lot of practices are set up that way, though, to where this is the way they do things and you go every 6 months no matter what.
Want the ratings for dentists in your area? Checkbook has ratings on dentists, orthodontists, and pediatric dentists in these 7 metro areas: Boston, Chicago, Minneapolis-St. Paul, Seattle and the Puget Sound area, the San Francisco Bay Area, Philadelphia and the Delaware Valley area, and Washington, D.C. Our advice is always free. Ratings of local services are available with a subscription. If you live in one of these 7 areas and haven't joined Checkbook yet, check us out. Get a free 30-day subscription by going to checkbook.org/consumerpedia.
Let's talk about some of the things that if you're going to find a new dentist, you should be asking for. So most people, I would assume, find out about a dentist by getting recommendations from their friends, and Checkbook members can check the ratings on a Checkbook.
I really think that's a good start. And we've asked a lot of friends on your behalf, what they think of their dentists by surveying consumers every year. And dentists is a category that we get a lot of ratings for. In each of the areas that we cover, we have hundreds of dentists that are rated by, at least 10 patients and often many, many times more than that.
Would it be appropriate to say, I want to come in and meet with you before the first appointment, or should you make the first appointment a simple cleaning and check it out that way, or what do you do?
Yeah, I think it's going to be difficult to learn much about the dentist from just a one-on-one in-person meeting. It's not such a bad thing to do, but I think you'll learn more from actually going and having a cleaning done. Most don't charge that much for cleaning and a quick exam. And that way you'll also know how the dentist operates. A lot of dentists these days, they run from chair to chair and don't spend much time with patients, and they leave it up to their hygienist to do much of the cleaning, and that's fine. But are they keeping delays down? Are the hygienists, are they gentle with you? Are they also telling you about things you can be doing to promote your dental health? These are things you'll find out by actually going for care as opposed to just having a conversation with a dentist.
And really important to find out what your dental insurance covers if you have it, or what dental insurance they take, or what the programs are for people who don't have dental insurance.
And check with your health insurance plan to see if it covers dental work. Even if you don't have specific dental coverage, you might be surprised to find that there's coverage there that you didn't know about. So for example, most comprehensive health insurance plans these days, most of them have dental benefits for kids. There are certain types of plans where they're required by law to have coverage for kids. In some states, all health insurance plans have to. That's true in Washington State, for example. There has to be some coverage for kids. The coverage you might get from one of those plans for your kids especially might not be very good. The health insurance plan I have is supposed to have coverage, but the orthodontia work my kid needs right now, and she has braces right now, my health insurance plan won't cover any of it because they say it's optional, that she didn't really have to have braces, which is kind of a ridiculous position to take, actually, if you'd seen her mouth before braces, but whatever. It was worth checking.
Right.
The other thing worth doing is funding your health savings accounts, setting aside money pre-tax. If you have that type of ability to do that, that's a good way to save money. You end up, depending on your tax bracket, you're going to save 20 to 40% by paying for costs pre-tax, essentially, rather than afterwards.
And again, for any listeners who are on Medicare and have a Medicare Advantage plan, some of the big plans do give you money back. They'll reimburse you for dental care and also some eye care these days. They're really getting good about adding those benefits. We mentioned this before, but ask the doctor, do you offer any specials or discounts or promotions or something that might be able to save me money?
It's definitely worth doing. We actually were surprised this time around when our undercover shoppers checked prices with dentists to find that many offered promotional programs especially for new patients. Mm-hmm. We found one, for example, that was doing the first cleaning and exam was only like $27. They were really trying to get new patients in the door, and that's one way they were doing that was by offering specials. You just have to watch out for they've lured you in with a low intro rate, right? And then they find a bunch of stuff wrong with you to actually fund themselves, pay for their bills. But it's worth asking about. Some dental practices are much more, especially if you don't have insurance, are much more likely to work with you on costs than others.
Consumerpedia Fast Facts. Tooth enamel is the hardest substance found in the human body. Even so, don't use your teeth to open bottles. Tooth prints are like fingerprints. They are unique to each person. Most of us don't take enough time to brush our teeth. The American Dental Association recommends 2 minutes twice a day. And chances are that brush is blue, the most popular color toothbrush, followed by red. Why? Who knows?
Let's finish up with talking about dental insurance. It's come up several times during our conversation, and the question is, should you buy dental insurance? Do you need to have dental insurance? It's probably something that's offered by your employer. Maybe it's extra, maybe it's not. What are your thoughts on that?
If your employer offers dental coverage and you can buy a policy at a reduced rate because your employer is picking up a share of the premium, it's definitely worth doing. Even if it costs you more each month in terms of your payroll deductions, it's definitely worth doing. If it's not, if it's something you have to pay fully out of pocket, it just depends. It depends on the level of care you need. The more care you need, the better deal dental insurance is going to be for you. And fortunately, when it comes to dentistry, you can usually predict how much care you're going to need the next year. And some of the care you might need. Now, if you need an emergency root canal, you're stuck. You need to go get it and get it paid for. But some things we know, especially if you're an adult, cavities even, you can usually wait a couple months before getting them filled before it's causing pain. If you need a new crown or you need a crown replacement, you can usually put that off until you can sign up for coverage. And also, by your history, right? I've needed a lot of dental care over my life. It's going to be a good idea to go ahead and sign up for insurance if you can get it. There are a lot of standalone plans out there. You see them widely advertised. And those plans are good deals if you need a lot of care also. A lot of them are really kind of prepaid plans where you buy into the plan, you pay them a premium each month for the year, and then basically get reduced rates at the dentists that participate in that network. It's like a dental HMO. The problem is that the providers that are affiliated with those plans, we find them not to be very good. That overall, the ratings that those dentists get that participate with those plans, they're a little bit lower than what you'd otherwise get with dentists that don't participate. But I think those plans are still worth seeking out and using if you know you're going to need a lot of care, and that's really the only way you have of paying for it.
One other thing, some dentists now offer this credit program because you have an expensive procedure. Don't worry about it. We got right here. There's a brochure. We're going to get you in this credit system here. Those things have horrendous interest rates, and people really need to be careful about them.
Yeah, you definitely do. And especially even when the dentist says, well, it's no interest for whatever, 2 years or something, the thing to pay attention to is what happens if you fall behind? What happens if you forget to make a payment? What happens if after those 2 years, there's still a balance? Because a lot of times they make it look like, it's, I get 12 or 24 months with no interest, no fees to pay this off. But what it really is it's a 5-year loan at like 18% interest or something. And once you've gone through that intro period of not having interest, now all the deferred interest charges, they hit you with that. So you really have to pay attention to what's being offered. Some dentists will very casually just let you pay off a dental bill over a series of months, right? It's an agreement between you and the practice. What you need to watch out for is when a third party gets involved, when they are essentially sending you to a bank or a lender to finance these things. You need to really pay attention to what you're paying for and think about whether or not you can get a better interest rate off your own credit card or paying through some other means.
And a final thought, as with all medical care, you've got to be involved in your treatment. You've got to speak up. And if the hygienist is hurting you or the dentist is doing something that doesn't feel comfortable or you're not sure about something or whatever, speak up. You're the patient. They're doing your body. And you have every right to say, I don't understand this, or what's going on, or why is this hurting so much, or whatever. Not just sit there and go, well, he or she went to medical school. They must know what's going on.
Yeah.
It's you. You got to speak up and stand up for yourself.
Yeah, and hear from so many people who avoid going to the dentist because they've had such lousy experiences in the past. It's been painful, or the dentist didn't listen. And in terms of pain, there are lots of ways to control pain these days, and dentists should be comfortable discussing pain control with you and what the different approaches might be and what your options might be. In terms of being anxious about going to the dentist. If you're anxious, speak up. Let them know. I'm just anxious about being here. I've had good experiences in the past. If they know, then they can help you. And so it's just like anything else. You really do have to advocate for yourself these days and for your kids in any environment in terms of healthcare, not just at the dentist, but at the hospital and in doctors' offices. It's really the doctors' and dentists' jobs to listen to you and communicate with you and let you be part of the process of caring for you. It's not just top down, they tell you what to do. It's very much these days should be the other way around, where patients can advocate for themselves and patients are the ones making the decisions about what's going on with their care.
And please, please, please don't be afraid to go to the dentist because of the COVID situation. The dentists have a lot of really good practices in place. If it concerns you, ask the dentist, what is your COVID protocol? But, you're not going to catch COVID from a dentist's office because bad teeth can really, really be a problem. We had a cleaning person when I was a kid. She died from tooth decay. It got so bad that it went into her blood system. She died. So, it can be a very, very bad situation. You got to take care of your teeth.
Yeah, and they're finding now over the years that good dental care is tied to all kinds of other outcomes in terms of diabetes and heart disease and other things. That the two are connected, and so it's not just about the cosmetic. It's not just about how you look, when you smile, right? Good dental care is tied to other good outcomes in terms of medical care, life expectancy, other things.
Well, Kevin, as always, great information. Now go brush and floss, okay?
Yeah, I'm thinking about going to buy this toothbrush. You need to tell me the model that you're using so I can check.
Well, that's this edition of Consumerpedia. Thank you so much for listening. Make sure you rate, review, and subscribe to us on Apple or Google Podcasts, Spotify, Stitcher, or wherever you listen to your podcasts. Remember, we release new episodes every other Thursday. Another way you can support the show is to follow Consumerpedia on Facebook and Instagram, and at My Consumerpedia on Twitter. I'm Herb Weisbaum, checkbook.org.
Consumerpedia is a public service of checkbook.org. We're a unique nonprofit that empowers you, the consumer, to save money and make smarter choices. From auto repair shops to doctors, plumbers to vets, you can count on checkbook.org to help you find the best services and avoid the worst. Local ratings are unbiased and accurate. If you live in or around these 7 cities and haven't joined Checkbook yet, check us out. Boston, Chicago, Philadelphia, Seattle, San Francisco, Minneapolis, St. Paul, and Washington, D.C. To get your free 30-day subscription, go to checkbook.org/Consumerpedia. Consumerpedia, empowering consumers to save money and make smarter choices.